What is rehab or rehabilitation? My name is Fred Bagares, a board-certified sports and spine medicine physician in Virginia Beach, Virginia. After 10 years of practice, I still find musculoskeletal medicine both fascinating and challenging. This podcast is about the lingering thoughts and questions I've had after residency and fellowship. My hope is to spark discussion, challenge dogma, and share my experiences in musculoskeletal medicine. Welcome to the Talking Rehab Podcast. What is the best tool? This is a very common question that I get in the clinic. It recently came up in the context of talking about steroid injections and how they are bad for you. With the use of biologics, steroid use has come into question, and particularly the fact that it does have some negative effects on the tissue structure that you are injecting, even though it has or can be effective in the short term. So what is the best tool? And this, in my mind, has sprung up a second question. What does the perfect tool look like? Because if you've practiced musculoskeletal medicine and spine medicine long enough, you know that there is not a single tool that works for everybody. So just kind of as a thought experiment, I started thinking about, well, what would the properties or the features be of a perfect tool? So I thought it would be a good exercise to at least come up with essentially a list of things that come to my mind after practicing for 10 plus years. First one I'll talk about is the cost. Obviously, the cheaper, the better. Inexpensive tools tend to be utilized more, followed by whether or not the treatment is being covered by insurance. And then, of course, free is also good. It's hard to turn something free down. Interestingly, it's sometimes hard to value things that are free. So another feature is the onset of action. When you receive a treatment in the clinic or in the operating room, onset of action should be very quick. Minutes to hours would be ideal. Some of these treatment options can take weeks to months. So that is always a general factor. Anything that takes a long time to kick in, I think, will be a tough sell unless the patient sees some inherent value right off the bat. Talking about response, predictability would be great. Knowing how well something's going to work, when is it going to work, how long it's going to last. That predictable factor is a very, very common question and would be a great feature of the perfect tool. Again, there's reliability. Even when you find a predictable tool, the response is good, knowing that it's going to be the same response every single time and that there's some element of permanence, that the effect will not wane. We'd also like the response to work for everybody. A lot of the treatments that have been studied are very strictly controlled for variables for research purposes. So that is one of the criticisms that I generally have when looking at old versus new technology. But again, as a thought experiment, generally works for everybody. That'd be nice to have. The next feature would be about risk. Obviously, minimal risk is ideal. Risk from side effects of the medication, but side effects of the procedure or medication. Minimal. If you are talking about a medication, there's minimal dependency. There's no tolerance that can be developed. And if you're taking any medications, there's minimal drug interaction. The next feature is something that is protective. And protective against what? I'll say protective against just general wear and tear that comes with age and time and use. And something, if this is a sport-related or recreational-related injury, something that protects you from the general movements within the sport, or something that decreases the chances of you being injured the same way again. So protective. Something that's non-invasive, something topical, something oral. Obviously, injections are invasive, but are a very common tool in the musculoskeletal world. And then there's obviously surgery. Minimal friction to get started. Again, as humans, we love things that are easy. Hard things tend to be the last thing on our list unless we have certain motivations. But something that is very easy to get started and the momentum is easy to maintain, that is an ideal feature. Minimal time investment. Again, we don't like to spend a lot of time into our treatments if we can help it. Who would want to spend a lot of time on something when they can get the same effect after one treatment? It is kind of an interesting dichotomy, though, because when pain is part of the picture, a lot of times we can't wait for relief. However, sometimes if the right tool comes along, people will wait. So it's kind of an interesting paradox. Something that delays natural degeneration. So understanding that all of our body parts are like any other physical structure. They change with time. They are affected by use, and things will generally start to wear down or change shape. This is part of the natural history of using our bodies, and if we are very physically active people, there's typically a consequence of using and loading our tissues more than others. So something that can generally delay that natural degeneration. The next one is what I call the Wolverine effect. It would be great if we had a tool that can regenerate tissue, particularly injured tissue, something that can be regenerated very quickly. And ideally, it will not only be healed, but better than when it first started, almost in the realm of reversing the degenerative changes that happen with time. The last feature that I will mention is permanence. We would like a tool that we can use once that lasts forever. If it is something that is implanted, like a prosthesis, or if we invest in a biologic and the part has been regenerated, we would love for that part to be indestructible. The last feature of permanence is sometimes we like the idea that it's not permanent. So it's really more of like a rent-to-own feature. So there are some solutions where a device can be implanted, but if it doesn't work out and you don't want it, it can actually be removed. So again, hitting some of the highlights: perfect tool, low cost, early onset of action, predictable and reliable response that works for everybody, something that has minimal risk, something that is protective, something that's non-invasive, minimal friction to get started, minimal time investment, delays natural degeneration. Again, has that Wolverine effect where tissue can regenerate quickly and also be stronger, and something that has permanence. The tool will last, or the effect of the tool will last forever, and something that's indestructible. So taking all of these features into account, I started looking at what are the available tools in the musculoskeletal world. Common medical treatment options, over-the-counter medications. In terms of injectables, there are the steroid injections and then non-steroid injections, biologics. When we start to get into prescription medications, there are the non-opioid classes and the opioid classes. And then last would be surgery. And past the medical part or medical treatment options, we also have, obviously movement and therapeutic exercise, recreational exercise. So those are the common tools that I think about when I'm trying to measure it against this perfect tool framework. So when I think of over-the-counter medications, where does this fall in? The pros are typically they're inexpensive if they're over-the-counter. Some over-the-counters are covered by insurance. Usually not free unless you have a physician that has samples within their office. Most over-the-counter medications, the onset, pretty good, minutes to hours. The response, though, is not predictable. and not reliable. On the whole, the risk is fairly minimal. Anti-inflammatories are sometimes a contraindication for certain conditions. Generally not protective. It's definitely non-invasive. It does hit the minimal friction to get started. That's usually easy for people. Definitely no significant time investment. In terms of all of the regenerative stuff and the permanence, that it definitely does not fit that bill. In terms of the injectables, the two non-regenerative injections that are common with arthritic disorders or tendinopathies is the cortisone or steroid injection. Now, hits a lot of marks in my book. Inexpensive, the onset of action is good. Response is not reliable, but when it does work, it's pretty good. In terms of the risk, now this again gets to the heart of what prompted this whole episode. You cannot debate that there are negative effects of steroid injections or steroid exposure in general if done too frequently or for long periods of time. But in the big picture of things, a one-time treatment, relatively minimal risk. Definitely not protective. It's definitely in the invasive realm. Friction to get started, probably the main barrier that I see is usually fear of needles. But more recently, I've definitely had people coming in kind of, very afraid of even trying a single steroid injection. So there might be a fear component I have to take into account. Minimal time investment for the patient. Typically, these are done fairly quickly in the clinic, and you will get a response within, at least in my experience, 3 to 5 days. Again, all the regenerative stuff definitely does not affect that piece of things. So that's definitely a general negative. But I guess we can dive right into the regenerative aspect of things. Regenerative medicine obviously is very much the cutting edge right now. It is a little bit of the Wild West. I've seen some really great stories, some kind of neutral stories, and there's a lot of literature coming out showing benefits, but there's also, you can find enough literature saying that there's no significant difference compared to standard treatment. But again, using this perfect tool framework, cost, definitely not cheap. Almost no commercial insurances cover it. There are one or two exceptions. When I was in the military as a contractor, regenerative treatments were covered, or at least no cost to the patient, but maybe to the taxpayer. But that was definitely an option. And onset of action, this I think is where the regenerative option is sometimes not great. It really depends on the patient and their timeline and their personality. You have to keep in mind that these regenerative injections, they are just a trigger for the body's natural healing response or inherent response. If you are the type of person that tends to heal really well, this might be a good option. But at the same time, if you're someone who heals really well, you might not really be injured or down and out that frequently. But I usually tell people it takes about 8 to 10 weeks to know whether or not the treatment is starting to work. So when you weigh that against the effectiveness of some of these other treatment options, this is something where biologics, it kind of falls behind, particularly if you're in pain. If you have someone who has an acute injury, they're in a lot of pain, and then you give them a biologic. I mean, most people won't, but again, this is just a thought experiment. But if you gave them biologic, it's going to take a couple of weeks. That person in severe pain may not be very happy, particularly since the response is unpredictable. It's not reliable. It doesn't work for everybody. So to get to the 10-week mark, only to say, well, it's only 50% better, that may or may not be satisfactory for some people. Now, the risk, I think this is really where biologics do shine, is that because most treatment options are your own tissue, so there's minimal risk from that standpoint. They're usually when they're doing PRP or bone marrow, that might probably may be the most invasive, where you might have some procedural site pain, but again, it's your own tissue, so the chances of you reacting are very low. Now, protective, I think this is also where the marketing and the bench science is still trying to get hashed out. Theoretically, there are studies that demonstrate that tissue can essentially regrow, or there is a delay in the degeneration rate. But in terms of actually in humans, I think it can be a little bit more theoretical. It's not a typical situation where someone gets a regenerative injection for their elbow and we re-image it post treatment to make sure that the imaging study demonstrates healing. On the whole, we typically are looking just to make sure that the pain is well controlled and they're able to increase their physical activity. But whether or not it's regenerating tissue, whether or not it's protective, I think the jury is still out. In terms of delaying the natural degeneration of things and the minimal friction to get started, a lot of people are definitely open to it. The main friction though is the cost. So I have had a lot of patients really want to, and I actually think they're a good candidate, but the cost and the unpredictability seem to be a big negative for obvious reasons. Do these make you Wolverine? I'm going to say probably not. I have seen people have a good outcome in terms of pain. I've seen tissue regenerate, but on the whole, I don't think that the tissue that is healed or has been triggered by the treatment is stronger than it ever was. Again, that's just my opinion. I'm sure if you ask enough people, you'll hear a different answer. In terms of permanence, again, most of the regenerative problems, most of the problems I see related to sports medicine clinic is usually an overuse injury, some acute trauma, but a lot of it is overuse. So even in the Wolverine scenario where the tissue completely regenerates and the pain is essentially eradicated and they get back to their previous level of activity, it's typically the activity that led to that particular point. Now, there is obviously a big piece that's missing, working on biomechanics and getting good sleep, good nutrition, things like that. But returning to the previous level of activity, the type of movement and activity that the sport demands, and just general time. I'm not trying to be negative, but I personally have not seen in a single injection of PRP be the silver bullet repetitive injuries. When people are doing high impact sports or repetitive injuries, they're just naturally going to be at a higher risk of injury because they're exposing themselves more frequently. And I just don't know if you can actually get around that. It's like trying to play football without contact. So, in terms of surgery, the cost, again, depending on your financial situation, your insurance, sometimes surgery may be the cheaper option. Sadly, I've definitely seen that scenario where all of the conservative management treatment options are actually very expensive, largely due to the way that their insurance plan is structured. But, it is a good option. Onset of action, again, this is a very theoretical discussion. Typically weeks to months. Tendon or disorders, ligament disorders, joint replacements. We're typically talking onset of action weeks to months. Response, on the whole, is fairly predictable. I think that physicians and the literature is pretty good on picking the ideal candidates for certain procedures. Doesn't work for everybody, but at the same time, I think that physicians do have some experience in that respect of trying to identify someone who is going to respond versus a non-responder. Risks of surgery always come with risk of anesthesia, so it's probably the most risky in the musculoskeletal world is even an elective surgery because of the anesthesia. But obviously postoperative infections / drug interactions, things like that. Protective, again, it doesn't really fit the bill. Helps with pain, but is it protective against the future? I guess there might be an argument for a rotator cuff tear, but typically the protective in the sense that a partial tear will become a full tear. That I think is very predictable. So from a protective standpoint, yes, I think maybe if a formal repair may be a form of protection of the shoulder, but in terms of the anatomy, no. Definitely an invasive procedure. Friction to get started. Sometimes it's interesting. I've had patients over the years just very, very anti-surgery or anti-conservative management. So sometimes the friction to start conservative treatment is because they are focused on getting a surgery. So sometimes the friction for surgery is quite minimal. So I am not shy about bringing up the option of surgery to my patients, because aside from trying to do all the conservative management stuff, it's a good idea to kind of measure your patients and ask them what do they think about surgery as an option. I like to just know that for myself, because if someone is really not a fan of surgery, I will tend to prioritize that discussion towards the end. But I think that makes the general relationship a little bit smoother, where you don't come across as just another physician trying to push a procedure on them. But again, sometimes minimal friction. Time investment, again, we kind of went into that. It kind of depends. In terms of healing, typically weeks to months. But sometimes, again, surgery is the better investment, because when you look at conservative management, PT, medications, injections, that typically can equate sometimes to 6 weeks to 3 months. And, minute for minute, dollar for dollar, sometimes a surgery is the better option. But it depends on the person, then their personal factors, and if, conservative treatment versus surgical treatment is best for them at this point in time. Now we're starting to get back into the Wolverine stuff and delaying natural degeneration. With delaying natural history or effects of natural history, I think there is an argument for surgery, particularly with ACL reconstructions and even with meniscus repairs. At least theoretically, the idea is for the surgery is to encourage a more stable joint to delay the effects of arthritis. So I think there is some merit to that. There's definitely some literature supporting that theory as well. Wolverine stuff, again, not really. But the last thing I'll mention is permanence. Even in the musculoskeletal world, I'd say that the most permanent would be a joint replacement. And at the same time, there is a lot of concern with patients about having to have the device revised. And it's also a factor for surgeons as well when trying to pick their patient. But rotator cuff repairs, ligamentous repairs, that kind of stuff, there really is no permanence. Again, I think that, the goals of the surgery are different. It's not necessarily to joint preservation. It's really just it might be secondarily, but it's, when it comes to joint replacement, it's not indestructible. It doesn't always last forever. It does last a long time, but it's not always forever. And it doesn't really meet that rent-to-own feature I had mentioned earlier. If you get a knee replacement and you don't like it, you're kind of stuck with it. The one treatment option I do mention that I pitch as rent-to-own is a spinal cord stimulator. It is something that you have to undergo a trial first before it's actually finally implanted. So even if it works and you decide you don't want it, it doesn't have to be permanently implanted. On the flip side, if you do get it implanted, it can be removed later down the line. But, it's also kind of a last resort. There are some imaging studies like MRIs and that you may or may not be able to have as a result of a permanent device. So another factor to consider. But anyhow, I just wanted to give you guys a just talk on this thought experiment about what does the perfect tool look like. I think it's very important for us to have this discussion as we, as a society, are looking to biohack and looking for the next big thing. Having a framework to look at these new and even old treatment options, I think, is a good practice for those listeners who are young attendings, but in particular for patients as well. Unfortunately, there's not really a silver bullet. I encourage you guys to keep an open mind and talk with your specialist or your primary care physician, kind of using this framework. I think it will give you some clarity, make sense of Dr. Google, and it'll help you kind of wade through all the information that's out there. So thanks for listening. Hope this was helpful. Thank you for listening to the Talking Rehab Podcast. I hope that this podcast stimulates you to question your own practice and how you approach rehabilitation. I truly appreciate your time and attention. If you enjoyed listening, make sure to like and subscribe to the podcast. I wish you a movement-filled day. Take care.